Alright, today we're going to go through some exercises to basically beat the 9 to 5. So recently what I found is that, when we go working out all day or you sit all day at work and you sit and go to the gym at night, basically you feel really tight, feel really sore, and you don't really want to work out. So all these exercises here are great just to basically loosen you up. You can do it before you work out as a warm-up or basically after a long day to get you in the mood to actually exercise. So the exercises we're going to go through today are basically stretch one part, basically tight muscles that you get tight over the day, and you're going to actually activate the other muscles, which are really weak and loose because you've been sitting all day. Okay. Okay. So basically, we're going to go through all the exercises. So first exercise is we're going to basically loosen through your pecs, really tight, lats tight. Because basically those two muscles, they're going to help bring you forward. So if you're sitting all day, you do a lot of gym. Bodybuilding, you're quite tight and stiff, so a lot of people are stiff like this. Okay. Next one is hip flexors. So if you've been sitting, this kind of sits in this position. They get quite short, so you stand up, you can't really stand up properly, you end up standing like this. Okay. So two muscles here. You want to actually get your glutes working to strengthen yourself up. You also want to straighten up a little bit back. Okay. Next one is TFL. So especially if you've been sort of sitting, your feet's kind of rolled in, you kind of cross your legs over, or you walk over and your foot quite flat. Basically your foot's going to roll in. This outer muscle is going to really quite tight. So you might notice is when you go to the gym, after you sit a long day, your knees actually get quite stiff. So the first few squats that you do, you're going to feel quite a bit of pain in the outside of your knees. So this will counteract that quite well by actually loosening through the front here. So basically you want to put the ball here, loosen through the front, and it helps bend your knees a bit easier. Okay. Last one is basically if you sit all day, you have a lot of tightness. A lot of you tend to go for massage, you get quite tight, quite bulky through the outer calves. Okay. Another thing is because most people have a bit of flat-footedness or they're quite weak. Okay, so the foot tends to roll in. So what we want to do is basically loosen the outsides and activate the insides. So today it's all about bringing your body back into a bit of balance. So if you're doing the same thing over and over again, your body tends to go a bit out of balance. Okay, and we want to drag it back into a bit of midline, because that's when you feel good. Okay, let's go for the first exercise. So pec pull. Yeah. That's okay, so you want to do is you want to get a ball. If it's doing basically you want to put it into the wall. You want to basically push your chest into the wall, into the ball, and until you find a sore spot. Basically, it should be along on the side of your clavicle. So you're reaching out to your shoulder. You shouldn't hit any bone, and you shouldn't hit your shoulder. Okay. So we zoom in through here. Let's get. Okay. Now what we want to find is basically roll around, find a sore spot, hold there, put some pressure there, and you want to basically relax the arm and reach forwards. If you notice some clicking in the shoulder, that's quite normal. Clicking basically means instability, so that's actually a good thing, because if you're still tight, that's a large click. If you're too tight, you're not going to get much mobility. So it's not going to click, it's just going to be stuck. So as it starts to loosen up, you're going to get a bit of extra mobility, and that's where clicking happens, because you don't have stability just yet. Okay? So when you first start, it's going to be quite sore. As it gets easier, it's going to be less sore, and that's when you can start to work on a bit of corrective exercises. So as you correct, you want to keep the shoulder down, reach forwards as far as you can, and up. Okay? This trains natural mobility patterns. So external rotation of the shoulder blade, upwards rotation, and not elevation. Okay? This is really important because a lot of people office workers have neck pain. It's because too tight in the chest, they end up starting to punch through the shoulders, and you get a lot of tightness in the upper neck. Okay? Great. So after a while, as you feel better, this should get less painful, and this should start to feel a bit easier. Okay. Next one. So we get Vanessa to lie down this way, facing that way. Pop the ball underneath the lat. So what you want to look for is just basically shoulder blades here, anywhere along through here. And you want to kind of slide forwards a little bit so it gets the back muscles. Make sure it's not on the point of the shoulder blade, so it's not painful in the bone, but in the meaty part of the muscle. Okay? So we look from this way. And you want to roll backwards and forwards until you feel that. Once you find a spot, it starts to loosen up. You want to hold it there with the hand. You want to basically heel it cab. Move the elbow back, move the thumb back. What you feel is activation through the back and pain underneath, okay? Making sure that your whole body is basically in one straight line. So if you don't want to have your elbow too far forward or too far back, you want to keep it in one line and pull back. Okay, as we talked about before, how this gets better is you notice that this range will get better and better as you go back. Okay, next one, lying on your stomach. You want to place the ball basically next to your belly button. So belly button's here, you want to place it on the right side if you want to work the right leg. Okay. Ideally, to get an extra stretch, you want to put a towel or a bit of a lift underneath the ball. So maybe that's on your right side. Yep. Okay. You want to try to lie straight a bit more. Okay. Perfect. Now what I want you to do is keep some pressure on the ball, so it should be quite painful underneneath. Okay. And you want to try to squeeze the bum, and you want to lift the whole leg slowly. The whole leg. And back down. If you do this correctly, you should feel a bit sore in the hip flexors and cramping or activation in the bum. Okay? As you get stronger, you can start to lift up and out a little bit. So this is really great in helping you to learn to straighten up, especially straighten up through the pelvis, straighten up through the lumbar spine. Okay, and relax. Okay, next one. A nice transition, you go straight into the side movement. Okay, so lying on this ball basically has to go from your hip bone here, your pelvic bone to your hip bone, basically where your pocket is, just a bit above where your pocket is, on a 45-degree angle in this position. Okay, let's try this. Now, it's a bit brutal, but you're going to find the sorest point in that muscle. And it will be really painful. Once you've found that, you're going to hold it there for a little bit. And to make it extra hard, you're going to teach your body to loosen this muscle as your knee bends. So you keep the knee in the same position, just try to bend both knees up. Down. Okay? What this does is it lengthens the whole muscle. So we've got an anchor point, we're pushing down on the muscle, and we're stretching the rest of the muscle and the rest of the tendon band. Obviously you want to do this both sides. Okay? We're going to move on to the last one. So we're going to sit up into the cross-legged position. You want to put this ball underneath, basically lateral outer side of this bone, lie on it, lean forwards a little bit, yep, and you can put some pressure on the knee. If you do this correctly, you might end up feeling some referral pain down to the foot. There's a lot of tightness through there. And you also want to get stuck into a bit of the front part as well a little bit. That's it. Okay? As an addition to this, just move this foot out a little bit. Okay? And I want you to try to point your toe down as you're doing this and up in a little bit. As you're putting pressure on the ball. Almost like you're trying to turn the foot so you can see the underside of your foot you actually see the underside of your foot. So you do this correctly, you should feel working the muscles through here and loosening muscles out through there. How you know you're doing it correctly is if you're getting much better activation through the inner parts, okay? Or a bit of cramping in the sole of your foot, okay? Perfect, that's done.